Hi, everyone. Welcome to the conference Lipodystrophy and Type 1 Diabetes. Why be careful? I will try to explain you what is lipodystrophy in English. I will do my best for sure. If you don't understand, you have some question, just put your question on the section Q&R on the top level or in the bottom of the screen. Oh, I see a question. Working is not, it's just a technical problem. It's not for me. Okay, I will try to do my best to explain you for you understand what I say about the lipodystrophy. When we talk about type 1 diabetes, it's important to talk about the injection. And I think the injection and the complication of the injection is very important. And I think the meeting today, it's very important to understand what is the disease we can have with and the complication we can have with insulin injection. First of all, I would like to introduce myself. My name is Tammy Cadieux. I'm a nurse educator. I work at Centre de Médecine Métabolique de la Nodière in Terrebonne. It's a small clinic who work with persons living with diabetes, obesity, and other metabolic disease. The clinic is open for now 6 years. Before I worked at hospital in diabetes center for 13 years. And I think I'm the majority of my practice as a nurse has done in diabetes center. Now we can move to the meeting. We talk about insulin injection. And you know, when you have to give you an injection, you have to take care about a lot of things. How many units I will give? Did I suppose to do exercise after the meals? Did I have to inject before, during, or after the meals? Did I have to inject more insulin because my blood sugar is high? Did I do EPO before the lunch? I have to just give less of units. You have to think about a lot of things for give you a safety injection. And when we talk about injection, you can talk about every different kind of injection. You can use a syringe, an injection pen, or infusion catheter with pump. We don't care about the type of injection. The important thing is when you do an insulin injection, you have to think about a lot of things, and this is one of the aspects we will look in today. When you do your injection, the majority of the time, you do just by autopilot. You just look at the menu, you say, okay, in my meals, I have 55 grams of glucose, I will put 20 units. You just think, oh, did I move after the lunch? Did I go to do exercise? Did I take some alcohol? Oh, my blood sugar is at 20. I have to give more insulin. But in normal, you just think care about the meals and what you can do after the meals or before the meals. It's really important to think about the place you will inject your insulin. And if you are all the time on automatic pilot, you will have some problem and we'll have some complication or disease about the quantity or the absorption you will have with your insulin injection. When we talk about the injection or a good injection, you have to stop and say, okay, if I would like to give a security insulin injection, what I have to think about it. First, we have to use the good tools. You have to use it. Is it the needle? Is it the best size for me? Did I take the good amount of insulin unit? Can I inject in the good place at the best time? Is it better to inject before the meals, after the meals, during the meals? And if I have the good technique for my injection, you know, sometimes it's better to inject at 90 degrees, sometimes it's 45 degrees. It depends on the person. It depends on many factors, the needle you use, the catheter you use, or the insulin, the syringe, or if you use a pen, we have a lot of things to think about it. And this is the reason why it's important to just know about each item. For today, we're just looking for the good place, because the injection is important to put at the good place for have a better result and have a better glucose control. What does mean good place? Good place is we have to inject an area who is recommended to inject insulin. We talk about abdomen, we talk about the arm, we talk about many places when looking after. We have to think about to do your injection on a healthy skin. No problem with the skin, no disease with the skin. And we're looking for do an injection at the subcutaneous level, not intramuscular level. And when we talk about the wrong place, we don't want to inject insulin on the wrong place. And what's mean wrong place? When you talk about, sometimes the person say, I would like to inject my insulin, I don't know, in the, I don't know how you say that, but in my thing, just in the middle, not at the other side. Can I go inside, not outside? Can I go here on the muscle place, or I have to go here? And it's so important to use the good place, because we have a lot of study who told us the place who are recommended, because we know how many units you inject, how many units you really use them. And if you don't go at the good place, you can have wrong units received. Sometimes they're just going fast, or they're not totally absorbed. And this is the reason why sometimes we can have a different control on your blood sugar. And we don't want to inject on damaged skin. They say no bump, no hole, no stretch mark, no redness, no injury, no bleeding. We're just looking for a perfect, healthy skin for doing an injection, to have the good result and have a good control. And we don't want to go intramuscular, because we know the insulin, they go more fast when you inject, and we can change the control after, and you can have more hypoglycemia after. If we're going on the right subject, we talk about the lipodystrophy. What means lipodystrophy? The lipodystrophy is an abnormality of the adipose tissue. They look under the skin when you inject insulin, when you do injection of insulin. They mean in the majority of the time, this problematic or this consequence of insulin injection, they arrive when we inject all the time or regularly at the same place. We have two different kinds of lipodystrophy. We have the lipohypertrophy and lipoatrophy. And this is two different kinds who have not give the same impact, and they don't have the same cause. If we talk about the first one, and we don't talk a lot about this because it's rather rare, we see more with women with type 1 diabetes who have another autoimmune disease. And we have now less case, because before we use different kind of insulin, animal insulin, and we see more lipoatrophy than now who use the better insulin. But it's all the time the same thing. It's when you inject insulin at the same place, like in the same area. And what's mean lipoatrophy? It's look like a depression on the skin. It's like a hole, or a small deep, or a big deep. It depends the size you have. If I give you an example by a picture, you can see here, we can see the hole. It's more long than bigger, but you can see the difference between the healthy area under the hole. And when you do your injection at this place, you don't know how many units you can use because you don't know if they can absorb your insulin. What caused the lipoatrophy? We think the most popular reason is because we have an immune response to the injection insulin. It's if your body just do a reaction about the injection of insulin. The damage you have inside under the skin is just like if the fatty layer is just remove them, they just disappear. And this is the reason why you can see just a small deep, a little bit more, and the hole is bigger, deep. And if you continue to inject in the same place, you have a deeper hole. Each time you continue, you have a deeper and deeper and deeper hole. And I talked to you about the use of animal insulin. We don't use it now for the majority of the patient. Now we talk about the more common lipodystrophy is the lipohypertrophy. They affect around 50 to 75% who inject insulin regularly. And this is the opposite of the atrophy, who they going under the skin. We have a bump. We can see bump. We can, when you feel the skin, you can just feel the bump. You can see when you look at if it's a little bit more bigger. It's look like a texture of rubbery. When you touch your skin, it's more a thickening area with fatty tissues. It's look like fibrous lesion or fibrous tissues. They can put together to do a big ball under the skin. And when you inject your insulin under this bump, it's more difficult to absorb the insulin, and you don't know how many units you really absorb. It's not because you inject 20 units or 5 units or 55 units. It's not sure you can have 100% of your injection because you don't know how many units they can just going under the ball and going under the healthy tissues to absorb your insulin. You don't know how many units you can have. The size, it will be very variable, the patient to patient. Sometimes it's look like a regular bump, sometimes it's not regular, sometimes it's more bigger. You can see when you look the patient, sometimes it's a different place. But in normal, it's all the time located at the same place you do your injection. You do your insulin injection regularly at the same place because sometimes it's just more automatic. We talk about automatic pilots. It's because you do all the time the same movement. You're going at the same place, not because you don't want to go there, but just because it's an automatic movement. I will show you some picture to explain what they look like. When I see a patient, all the appointment, I look on the side and I say to the patient, do you have problem with your side? Do you want to look at the side? Do you have problem with variability on your blood glucose? And when we look, sometimes we just say, oh, you have lipohypertrophy. And they say, I have what? Or when I ask patient to examine his body, they say, why do you want to look at my skin? Because nobody do it before. It's very, very important to do exam to the patient to know, because it's a consequence of insulin injection. And we know they can have a big impact on your blood glucose control. And if we look on this picture, you can see we have two different bumps. We can see when you look in there, we can't touch them, but we can see. You have one at the bottom of the left side and one at the right side too. They have two different at the same place, but one right and one left. It's just because the person just go by easier thing, they just go to the same movement at the same place. We have another one who are just a little bit more different at right and on the left side. The person who use if a right arm, they just going more regular on the right side. This is the reason why sometimes it's more bigger on the size who use your arm regularly. And you have another one, but the other side is just a little bit more smaller. If we do on this one, it's just beginning, but we can see three different places. you can see at the bottom of the picture at the right, you have more bigger. It's a little bit more small on the left side of the body. And if you look just a little bit more higher, you can see a small one there. It's more easier for me because I know the patient and I know where is it, because I can see, but I can touch them. And here, this is what I see on the arm. If you look on the right picture, you can see the little bit bump. It's not very easy to see them, but it's small one. But if you look more closer, you can see the small one. They just became they go outside the skin. They're just not inside, but they see outside the skin. This is one picture. It's not knee. It's very, very, very on the thing that we can see the two big bump, but not at the same level. If you look on the left side and the right side, sometimes we just inject a little bit more higher, just a little bit more down, but all the time the person just do the injection in the same place. When we look what they look like inside the skin, because when you look on your body, you just see the outside of the skin, but now I would like to show you what's going on inside. When you look, you see your skin, but they have some tissues under the skin. You have subcutaneous tissues and you have the muscle. When you look on the left picture, you can see a small lipohypertrophy. You can see they just install one, they just a little bit more small, but you can see the subcutaneous tissue who are a little bit more bumped. If they continue to inject at the same place, they will going more bigger, more bigger, more bigger. And you can see the ball inside, they grow up, they just become more bigger. And when it's bigger to bigger to bigger, you can see your skin who do a bump too. And this is the reason why you can see them on the right side. And if you look on the left side, you don't see them. But if you touch, you can know they have one because it's more hard. You can touch them and you know they have something wrong on this place. Now, I would like to show you, when I see you, you see the external view. You don't see what's going on inside. And this is the best picture I think I have to explain to you what's going on inside. When you do your injection on the lipohypertrophy, on a small bump, sometimes you don't know it's a lipohypertrophy, you just think it's just a little bit more fat on this place. But inside, you are all the fibrous tissues they have there. And if you have a big ball or a small ball inside and you don't know you have it, then when you inject there, the insulin can be just keep inside and you don't have a real absorption on your unit. You can inject them. This is the reason why I think it's important to just remind you they have something inside the small bump, and this is the reason why we don't have to go there when you do your injection. It's because you can have a lot of issue if you go at this place just because the tissue is not normal, it's not healthy, and this is the reason why you don't have to go there, because you don't know what's going on with your insulin you inject there. We have different causes of lipohypertrophy. We have two big risks than other. The first one is the duration of insulin therapy, how many times you use insulin, and the repetition or your injection at the same place in the same small area. I told you about the automatic pilots. It's all the time the same movement. You just inject in the same place. And sometimes it's just because people reuse the needle. It's more easier to keep the needle and keep the needle for many, many, many injections. I have patients who just change the needle when they change the cartridge inside the pen. And this is one of the problems we can have. This is why we have more lipohypertrophy, more bigger size of the problem. What is the consequence about the injection on the lipodystrophy? The first thing is anesthetic appearance. This is not the major point for your diabetes control because it's important for your healthy mind, but when you talk about the aspect of the control, good control, it's look at the three other things. If you do an injection on the fibrous tissue, I told you about the fluctuation, about the amount of insulin are absorbed, because you don't know how many units you really absorb. And if you don't know the unit that you inject each time, you told me when I take the breakfast, I take all the time the same thing. I take butter peanut with 2 bread, with 1 yogurt and 1 coffee, and I give all the time the same unit. I just give more if my blood glucose is a little bit more high, but all the time I do the same thing. And sometime after the meals, I'm going up, or sometime I'm going down. And I don't know why it's going that way. I go on the bump, down, up, down. And sometimes it's just, I don't know why. And the first thing I will think about it, it's where the patient gave the injection. Did they use the good tool at the good place with the good needle? I'm just looking for the technique that I'm sure when the patient do his injection, it's healthy skin, because I know they can have a real impact on the fluctuation or the amount of insulin are absorbed. And when we talk about the fluctuation, about the amount of insulin are absorbed, you know they can have a real impact on the glycemic variability. Hypo, 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 and we know how fair you can have about unexpected hypoglycemia, because they have a real impact on your quality of life. And if you have a lot of glycemic variability, you can increase the A1C level. They just a reflection of the pure control, because you have a lot of variability. You're going on a roller coaster. You go up, you go down, you go up, and you go down. When you do a LT insulin injection, you want to go up subcutaneous injection on this healthy skin with no disease. You want to inject the good amount of insulin at the good place. This is the best thing we can have. It's a perfect injection at the perfect place. If you do that, we know at the majority of the time, all the injection you inject will be absorbed. And if you do the exact technique at the good place, you will have a better repetition of what you're supposed to have, because it's all the time the same thing. If you do at the wrong place and you inject your insulin on a bump or on a hole, you don't know how many units you can absorb. And if you go that way, you know, by example, if you do on the middle of the lipohypertrophy or on the bump, you know we have a majority or a small part, or the 20% or 50% or on 100% the insulin was absorbed or not absorbed. And sometimes we have a few units, they can just go and they just go a little bit more down and go on the healthy skin, and you can just absorb that, but you never know how many units you really absorb. And if you go just a bit more another place on the bump, on the side of the bump, it's the same thing. You don't know how many units they are on the tissue, and how many units go and get absorbed on the good place to have a good result. And if you go on the healthy skin with no disease, you know, no bump, no injury, no bleeding, no bump, you know the exact thing. With the majority of the time, the injection will be absorbed at the 100% of the unit you can inject. And this is the major point we have. If you go at the wrong place, you can't know how many units your body will be absorbed, and you don't know how many units they can have an impact. And if you decided to give more, you will have sometime hypo, and sometime you just say, oh, my blood sugar is a better control. But if the next time you inject on the good place, you have hypo because they have too much insulin at this time. This is the reason why if you change place, you have to talk with your healthcare professional to just decrease a little bit your unit to just be secure, to have an injection, to don't give you hypoglycemia. And when, I think this is the most important thing, just think if you inject in the lipo, you never know how many units your body is really absorbed. And I think this is the major point because it's the result of glycemic variability we have. Sometimes when I talk to the patient, I say, why do you inject on this bump? And they told me because it's painless injection, because we don't have a nerve index under the skin. And the patient say it's just more easier because we have no painful. And if I change place and I go empty place, I have more pain. But this is the time to know we have to change the needle, if my techniques, it's okay or not. But the majority of the time, the patient just don't go, they just don't know they have lipo, or they don't know the consequence about the injection of the lipo. They just don't know about what is the good injection area for him or for her. They don't know about all the information we're supposed to know about the technique or the tools or the area we can inject them. And sometimes it's just automatic pilot. It's a reflex, an habit. We just do the same movement each time, every day, day after day, injection after injection. This is the reason why we have to stop to our automatic pilot and they say, okay, I have to take 1 second to just look on my body and give a secure injection. One of the major questions I have frequently is, will the lipo disappear? It will be very different patient to another one. After 3 or 6 months without any injection, you can see a decrease of 50% of the lipo hypertrophy. But if you going sometime, they will not disappear. If you have the lipodystrophy for many years, sometimes they just don't disappear. And sometimes if it's more new, sometimes they will just disappear completely. It's very dependent patient to another one, but in the majority of the time, they just decrease size. They just don't disappear completely, but they just reduce because we have more inflammation section. If you go, what I can do for have no lipodystrophy, or what I can do if I would like to change or do better injection technique, I think it's prevention. And what is mean prevention on insulin injection? The first one is choose a good injection zone. What is a good injection zone? It's abdominal. I don't put in English this section. I'm sorry about that. But if you look on the abdomen, the section, sometimes the patient just put on a small area. And when you look on the buttock, sometimes the person say, oh, I can go there because it's too hard to do a good injection. And when we talk about your arm, it's the same thing. If you are impossible for you to give at the good place at 90 degrees, don't go there. And I think this is the reason why it's important to talk with your healthcare professional to determine what is the best place for you, because you have restrictions. Sometimes it's easy for a person to go on the back. Sometimes it's not easy for some people. And you have to look what is a good area. In the same area, you can have different zone. And this is what we're looking for when we talk about a small one, a small zone. Sometimes it's because the patient just inject one or two, I don't know how you say it in English, but just a small place around the bottom. But sometimes the patients they use all the abdomen, but some people who just don't use it, all the section. And when we talk on the belly button, if you go on that side, you can just don't go on the middle on your belly button, but you can use all the abdomen. You can use on the section on here. You can go on the back too. This is the reason why it's important to examine your body and to talk with healthcare professional to know what is the good zone for you. If my skin is healthy, I have some problem at the different zone. If we have some problem, we just put X on that zone. We don't go never on this place because we know they can have a difference. Now in the part 2, what I can do, you can have a structured injection plan. This is not easier because when you do injection, we talked before about all the thing you have to think about it when you do an injection. Imagine you have to remember, if I use on my abdomen the zone 1, and okay, this morning I put here, I have to remember what of a thing to inject the other one. I don't remember the exactly point I inject the insulin the last time. It's a little bit more hard to remember. You can ask, again, your healthcare professional to have picture to just put at home and for remind where I do my injection or no. When you use insulin pump, you can stay the injection site now and put another one, and after you can just keep the other one, and you know exactly. But when you do an injection with a pen or with a syringe, it's very more hard to know exactly where you do your injection. And this is why it's a little bit, this type of plan, it's more hard. In my practice, I use more these tools. I think we have different healthcare professionals have different kind of tools, but for my part, when I use colored needle, I think it's more easier. And we have a recent study who told they can improve the injection rotation with the color, because when you open the box, they say when you change color, you change site. If you change site, it means you change zone. And it's different if you use, by example, 2 zone, you can use your bottom with your abdomen, or you just use your abdomen. You can put different color. In the box, you have some paper with sticker, different sticker with different color. You can put and create your own plan to know where I go to inject. And if the nurse told you don't go at zone 1 on the abdomen because you have lipohypertrophy, just put an X on this zone and you don't put a color. But when you open the box, you have 100 needle in the box and you have 25 per color. And when you take a blue, you go on the blue zone. When you take a yellow, you go on the yellow zone. And when you take a purple, you go on the purple. This is more easier than use and reminder the place and put my finger to reminder, because it's more hard to remember where I do before. And I think for me, in my practice, I see better result with that kind of tools. The other point you can do for prevention is examine the site and the location you want to go and to use for the injection. I think regularly, 1 per week, 1 per month, you have to do a very big exam to look each site you're going. But every injection, just take a small look, just put your arms and use your finger to do a circular sweep to just put and know, oh, I think they have a little bit bump here. I don't go there. I would use another one. Oh, this is perfect. I will go there. They take few seconds, but they can give you a better control and give you a better result with your blood sugar, because we have a better absorption on your insulin. It's very important to just take a look and take your finger to just look on the area, for palpate the skin to know what's going on. When you talk about the needle, this is another major point. We have to change the needle each time you do your injection. When you use a needle many times or multiple use, you hook the needle types. This is when you going for the first time, the needle are very sharpening and they just go very easy on the skin. After 2 use, if you go on the left picture, you can see the type of the needle a little bit on blonde. And if you see after multiple use, it's just after 1 day, if you use 4 times, 5 times, or 6 times a day, you can have a hook. They just like this. And when you go a hook under the skin, they just do an injury on your skin. You have some bleeding. You can have some problem because you can increase the risk of infection. And I think this is the reason why it's so important to change each time you do your injection. Let's look inside your skin. I will give you an example. Just a reminder, I would like to show you what's going on inside your body. When you use the same old needle day after day, week after week, or just few injection after few injection, you do micro trauma. You remember the needle is not perfectly normal. They just give a small trauma. This is increase the risk of bleeding. They increase the bruising. Here you can see the different color of the skin. And after, when you use it, you have more risk of injection with the bacteria, and you can see them, you can have more risk inside, and you can increase the risk of painful injection because you do an injury each time you do your injection. Now, I think another point I told you many times today, you have to screen your body. You have to do a screening each time you go to appointment with your healthcare professional. You have to review your site. You have to know what is the good site for you and what is the wrong place or the wrong zone you can't go because you have some problem with the skin. You have to review your injection technique, and you have to use the good tool, the good type of needles, the good size of your needle. You have to take about all the things about your insulin injection, and you can see a real difference with your blood sugar control. I think that's it for the presentation. We'll go see on the Q&A section to, oh, I think they don't have questions. I think Sarah asked, answered the question before. If you have some question, I will be there. Just write on the Q&A section. I hope you appreciate the meeting. And just remember, it's not just the amount of unit insulin you give, but the place. It's very important to decrease the risk of variability you have when you do your injection, because under the skin, you don't know how amount of insulin are really absorbed in your skin. I think you don't have questions. I hope you enjoy the meeting, and I think you can have a good afternoon. Thank you so much for your participation. Have a great day.